Hi, my name is Derek Davis, and our group consisted of Alyssa DeSantis, Cavell Griffiths Blair, Catherine Corona, and myself. And this is our theory-informed case presentation. So to begin, we'll analyze and we'll take a look at our case study. And our case study was for Mrs. Rodriguez. So Mrs. Rodriguez is a 70-year-old Hispanic female who resides alone in her inner city apartment. 3 years ago, her husband died after a long, debilitating illness. Mrs. Rodriguez has five children who are all grown, and only two of them live locally. Mrs. Rodriguez keeps in touch weekly with all of her adult children, and each one of them are very up to date with her daily functioning. 2 months ago, Mrs. Rodriguez was taken to the hospital by ambulance due to a fall she incurred while walking around her apartment. The result of this fall was a broken hip, which required that she receive physical therapy followed by a period of being homebound. Her doctor was made aware that she was under the influence of alcohol at the time of her injury. During her assessment by a social worker in the hospital, it was determined that Mrs. Rodriguez had been increasing her usage of alcohol and had symptoms of decreased appetite, loss of interest in pleasurable activities, as well as trouble falling asleep and trouble staying asleep. These symptoms had progressively worsened once her husband died, leaving her alone in her apartment. Mrs. Rodriguez reported that she often isolates at home and that she no longer goes out with friends like she once did in the past. Her daughters who live out of the area have expressed concern to their mother about her change in behavior since their father passed away. Mrs. Rodriguez's sons who live locally both drink and do not feel that their mother has an alcohol or a mental health problem. Mrs. Rodriguez is on several different medications for high blood pressure, high cholesterol, and heart issues. At the time of admission to the hospital for her broken hip, Mrs. Rodriguez had never previously received any outpatient or inpatient treatment for alcoholism or mental health issues. So, as we examine Mrs. Rodriguez's case, we'll take a look at two theories. The first theory that we'll utilize is the biopsychosocial spiritual theory. And what is that theory? So, using that theory to inform our assessment, looking through the biopsychosocial spiritual lens, what information would we gather from the client? So this theory takes a thorough and holistic assessment of the client. So we are examining the client holistically through multiple different lenses. So we are looking at the client from a biological lens, psychological, we're considering the client's social and spiritual factors. It's also a strengths-based theory. So we're also considering what are the client's strengths? What strengths does Mrs. Rodriguez possess? So what do we want to know when looking at Mrs. Rodriguez through a biopsychosocial spiritual lens? So we would want to know, again, it's a holistic assessment. So we'll break it down by the four factors that we would consider. So first, we're going to take a look biologically, physically. So we can see that Mrs. Rodriguez is a 70-year-old Hispanic female. She has broken her hip. She has increased her alcohol use. She has high blood pressure, high cholesterol, and heart issues. Psychologically, we see that Mrs. Rodriguez is experiencing grief from losing her husband, loss of pleasure, trouble sleeping, and again, that increased alcohol use. Socially, we know that Mrs. Rodriguez keeps in touch with her children, but she also isolates in her home and doesn't go out with friends like she once did. The spiritual factors based on the case study are not known. So, using our theory, how would we be able to understand Mrs. Rodriguez's situation or experience. Well, as mentioned, this theory takes a holistic and person-centered view of the client. So we are looking at Mrs. Rodriguez in her environment. As we learned from our textbook, this theory considers the complementary system devised by society to deal with the disruptive effects of illness. So not only are we looking at Mrs. Rodriguez as a person, but we're also considering the neighborhood, the system that she is a part of in society. And how might the biopsychosocial spiritual theory explain or predict the behavior that we're seeing? So, as we said, we're examining Mrs. Rodriguez holistically, and we can see that the increase in alcohol consumption, her trouble with sleeping, and isolating socially could be explained by grieving the loss of her husband. That's the behavior that we're seeing. We could also see that maybe the alcohol use could be seen as self-medicating, which, as we know, the alcohol use played a role in the client falling and breaking her hip. Next, the theory informed an intervention. So, were you a social worker working with this client? How might the biopsychosocial spiritual theory influence the choices and actions you would take to help this client? Well, first, we recognize that this theory is for assessments. So it's used for assessments. It does not have specific interventions, but based on the thorough and holistic assessment, we can use that to best inform the most beneficial interventions for our client. So we are looking at our client holistically, and we're working together with our client to potentially provide multiple interventions that would align with what Mrs. Rodriguez needs. So the actions that we would take would help Mrs. Rodriguez achieve self-determination. It would also target the areas of her life that she herself, as the client, would like to address. This theory could help inform the type of referrals that we could make for those effective interventions. So, with this theory in mind, with our holistic assessment in mind, we could consider the client's interest in resources or interventions such as therapy for her grief and depression, such as utilizing CBT. We could also take a look and explore if Mrs. Rodriguez would like to address the alcohol use. We could also explore her interest in maybe getting reintegrated into social activities. For example, we could refer her to a local senior center. We could refer her to a local YMCA and any other areas of socializing the client would be interested in. And these interventions, these are informed by this thorough assessment we did with our theory. Some other interventions and referrals we could make would be at-home services, such as, if she needs to continue physical therapy for her hip, or if maybe to get, food delivered to her house. We could also talk about Meals on Wheels. Okay, so as we reflect on this theory and critique it a bit, we have two questions here. So, what does the evidence or the research support look like for the biopsychosocial spiritual theory? So, the research tells us kind of two different things. It tells us that this model is effective and that it can be tailored to fit various practice setting and a diverse population group. However, research also tells us that this theory will never rise to the level to become a scientific paradigm. And the research says that's because it is holistically, it just takes into account too many kind of variables. Next, looking at social justice. So where or how do we notice a connection between the concepts of power, privilege, and oppression? So does our biopsychosocial spiritual theory consider issues of power and privilege? And through our research, we learned that it does. So we know that this theory is actually the first to advocate for a patient-centered view of treatment that sought to reverse the dehumanization and the disempowerment of patients. We also know that in this theory, the client's voice is crucial and takes into account the client's environment. And we know that the client's environment may have been, there's a high percentage chance that that environment has been impacted by structural racism. Moving to our second theory, and that theory is our cognitive behavioral theory. So, when gathering information through a CBT lens, we would look at the client's previous accomplishments, strengths, personal qualities, and resources. We'd also look to understand Mrs. Rodriguez's previous life experiences and how they have contributed to the development and maintenance of her current psychological difficulties, such as the passing of her husband, her children moving away from her, living in the inner city, the development of her health problems, and her increased alcohol use. We'd also be interested in assessing Mrs. Rodriguez's previous and ongoing strengths to adaptively cope with these challenges, including her friends who are actively in her life, any children and grandchildren that she can spend time with, any religious beliefs she may have or spiritual beliefs, and activities that she enjoys doing. When looking at Mrs. Rodriguez through a CBT lens, we would want to know her life history, including any situations she may have encountered that would result in a maladaptive behavior or negative emotions, including if she has a family member with a history of alcoholism, or if she had any challenges with being a wife, a mother, or a friend. Additionally, we'd want to know and identify specific situations that result in Mrs. Rodriguez using alcohol, including any feelings of depression or anxiety, feeling lonely, being stressed, or if she's been using it to experience pleasure and a sense of euphoria. Next, as we continue on with our theory informed assessment, we would like to look at the reason why Mrs. Rodriguez is drinking. Specifically, what is the trigger for her drinking? These could range from external factors such as social situations or internal factors such as anxiety, stress, loneliness, or boredom. We would then look at the beliefs that Mrs. Rodriguez has when she's drinking. Beliefs along the lines of maybe a drink will help her to relax, or that no one cares about her having one drink. Then we would want to look at what are the consequences of her drinking, which could include a decline in health or shame. We would look at her core beliefs and why she's using alcohol to cope with her situation. So knowing her core beliefs can help change her cognitive distortions. One example would be if Mrs. Rodriguez stated that she drank because she can't stand the stress of losing her husband. The core belief there behind that thought would be that she uses alcohol to escape from uncomfortable feelings. Since we were able to successfully understand the core beliefs, we can then accurately label the emotions and create coping strategies. So, other information we would like to be able to collect, or that we would be able to collect, includes any automatic thoughts that may have arisen since her husband's passing. For example, I no longer have a purpose, I am a burden, or I cannot manage on my own. Fundamental beliefs concerning her aging, independence, and loneliness. Factors that trigger alcohol consumption, such as nighttime loneliness, reminders of grief, or feelings of boredom. Any avoidance behaviors, and the relationship between alcohol use, depression, and existing medical conditions. For example, her hypertension, her cardiac issues, and the medications she's on. So we know that cognitive behavioral therapy explains the alcohol use we are seeing from Ms. Rodriguez because it examines the relationship between her thoughts and how they are causing her behavior. It also examines her emotions' effect on her behavior. For example, Mrs. Rodriguez might have an all or nothing cognitive distortion. This would cause her to think, for example, I already had one drink. What is the harm in getting drunk? Another thought that she may have is that one drink will help me to feel normal again since my husband's passing. I deserve this. These beliefs are a negative coping strategy that will allow her to continue the behavior because she is using them as a justification for drinking. Other explanations and predictions for her behavior include the effect her husband's passing and her adjustment process, her shifts in her social roles, the transition ensuing from her physical injury, the cultural and familial expectations rooted in her Hispanic heritage, and her family dynamics. The actions and choices we would like to take include identify and address negative thoughts associated with grief. For example, I am alone. Life has no purpose now. We would teach coping techniques such as grounding, thought stopping, and cognitive reframing. Implement behavioral activation to progressively increase her enjoyable activities, her social engagement, and her daily routines. We would assess high risk situations for alcohol use and develop alternative coping mechanisms. And if appropriate, provide referrals for medication assessment. Next, we would want to teach her about her core beliefs and how they influence her automatic thoughts and her cognitive distortions. So as we reflect and we critique the CBT theory, so there is substantial empirical evidence that supports the effectiveness of treating late life depression, grief, and alcohol misuse. It's particularly beneficial for older adults due to its structured, practical, and skill-oriented approach. Research indicates that CBT decreases the likelihood of depression relapsing and enhances functioning across diverse populations. The limitation to CBT is that it may not adequately address cultural nuances or systemic challenges faced by older adults. Cultural context. In some Hispanic families, alcohol consumption is considered customary, and mental illness may be downplayed, potentially shaping the son's response. Older widowed women frequently face financial disparities and increased loneliness. Healthcare providers might attribute symptoms to normal aging, resulting in delayed treatment. Seniors residing in low-income neighborhoods often encountered restricted access to quality healthcare, reliable transportation, and safe housing. Access to culturally sensitive services can be limited in urban inner city areas. And lastly, family power dynamics. While daughters express concern, her sons tend to minimize the issue, reflecting cultural gender roles that can influence how her needs are met. Those are the two theories that we have utilized to examine the case study of Mrs. Rodriguez. Thank you.